Senator Chris Murphy of Connecticut joins us now. Senator, when I look at this gun legislation, I'm reminded of a couple of quotes from political giants from the 19th century. One was Bismarck, who, of course, said politics is the art of the possible. Second was Abraham Lincoln, who said, I'm a slow walker, but I never walk back. I guess this is a step forward, right?
It is. I mean, there's a reason why we haven't passed any anti-gun violence legislation in 30 years. This is difficult. And the fact of the matter is we reached a compromise over the weekend that will save lives. I understand that part of the news here is the breakthrough, because I think you're right. This does allow us to break this log jam, and it allows us to be set up for future success. But the content of this compromise in and of itself will save lives. The ability to help states pass red flag laws will stop thousands of suicides and homicides. The closing of the boyfriend loophole means that domestic abusers, boyfriends that beat up their girlfriends, won't be able to buy guns. The protections for 21 and under buyers, that means that there's a pause for any 18 to 20-year-old who is going into a store to try to buy an AR-15, like the Uvalde shooter, an ability for the police department to intervene. And then the mental health spending is going to be transformative in and of itself. We're talking about billions of new dollars for mental health, a lot of it going to underserved communities. That's going to save lives, too. This is a compromise, but it is a difference maker. It is a substantial compromise that is going to stop a lot of suicides, a lot of homicides, and save a lot of lives in this country. I'm really proud of it, and I'm proud of my negotiating partners for coming to the table and getting this done.
A couple of things to draw out there. First, let's talk about on the gun side of things. I would guess most Americans think that it makes sense to move the age from 18 to 21, at the very least, for the selling of weapons of war. You didn't have the votes for that, but tell me what new safeguards are in place there specifically that will make a real difference?
Yeah, I think when we started to count the votes in the Senate, it just was not clear that we had 60 votes to raise the age, obviously something that I support. But in many ways, what we built into the law is a pretty significant change. First, there's going to be a pause for any 18 to 21-year-old buyer in order to conduct this more comprehensive background check. And part of that comprehensive check is a call to the local police department. Now, in the Uvalde case, this individual probably didn't have a prohibition that would have stopped him from buying a weapon, but he did have interactions with the police department, and that alert to the local police department that this very disturbed young man was going to the gun store days after his 18th birthday to buy 2 assault weapons would have set off a red flag, and perhaps would have led to an intervention that could have stopped this murder. So that pause that we've built in, I really do believe will save lives. And so, while it's not everything I want, it is much better than current law, and again, is going to, I think, stop many of these mass atrocities from happening.
So the second thing is let's talk about health care, mental health care. It's something we've talked about a great deal on this show, and specifically increasing funding for mental health care in underserved areas. If you're on the East Coast, if you're on the West Coast, if you're in metropolitan centers, chances are good you have more access to health care, mental health care. But you look at Uvalde and you look at some of these other people that are falling through the cracks. This is where so many of these tragedies are occurring. What can you tell us about the funding mechanism for the mental health part of this compromise?
Well, we have not announced any numbers, but suffice it to say, we're talking about billions of new dollars in mental health spending that will be part of this bill. Our intention is to pay for it, and that's important to all of us, but especially to many Republicans. We're going to do 3 main things. First, we're going to build out a national system of community health centers. This is something that Debbie Stabenow and Senator Roy Blunt have been working very hard on. Those will be focused on underserved underserved areas, so new community health centers all across the country. Second, we're going to invest in telehealth. That's really important to rural communities. We're going to make it easier for people who live in rural communities to be able to get access to mental health via the internet or the phone. And lastly, we're going to invest in school-based mental health. We're going to put a lot of new money into building mental health clinics in our schools so that more kids get served there. I haven't run the numbers based on comparisons to previous investments, but this will be one of the biggest non-budgetary investments in mental health in the history of the country.
And Senator, I may be getting into the weeds too much, but on mental health, I think that the thing that people will go to first is to, create places where people who are feeling sick will go to, or responding to mental health problems, when many might argue that a mainstreaming of mental health services, mental health training, social emotional training, self-regulation training should go into classrooms as a form of prevention.
Well, you'll see as you read our outline that that's what we intend to do, is to build safe schools, and building safe schools means creating teachers and administrators who can identify the warning signs of mental illness. Now, let me be clear. I have always been uncomfortable sort of pairing these conversations of gun violence and mental health, because there is no evidence that people who are mentally ill are prone to violence. In fact, they are more likely to be the victims of violence. And I don't want to do anything here that builds a stigma around people with mental illness, nor do I think that investing in mental illness is the primary solution to our gun violence problem. But boy, why would we balk at an opportunity to build with Republicans a massive new investment in a broken mental health system, so long as at the same time we are making significant changes to our gun laws, which we are doing in this bill.
I couldn't agree. Yeah. I couldn't agree more. I'm sure a lot of people out there couldn't agree more. We've been having Debbie Stabenow on this show for years now, talking about the need to increase mental health coverage. And Jonathan Lemire, as you know, Meek and I have been talking for some time. A real concern about mental health in underserved communities, especially for younger Americans. And yes, it's so many people. And you have the governor of Texas talking about mental health, but he's cutting mental health. That's a cop-out. So if Republicans will come to the table and they think they're hiding behind mental health while funding it, that's fine, because you move forward on gun safety, on public safety, and you move forward on helping those Americans who need mental health counseling.
Yeah, to be sure, some of the GOP focus on mental health felt like an excuse to not deal with guns, but that's not to downplay the importance of mental health, too. That is certainly a key part of this. And Senator, certainly this is progress. And we heard from a number of people over the last day or so note that this is a good step forward in the right direction, if perhaps incremental. And part of that is the fact that you have, at least so far, 10 Republicans signing on. What is your hope that number, A, could grow immediately, but B, down the road, that perhaps this could provide a sense to Republicans that they can stand for some sort of gun measure, maybe not pay the price at the ballot box, and lead to further, more substantial movement down in the future, perhaps not requiring another mass shooting to prompt it?
So I think the theory is exactly right, and I've been saying this for years. I think there's been this mythology out there in America that you pay a political price, that you will lose your primary or your election if you step out and support these common sense gun measures supported by 90% of Americans. Now, we've never been able to test that theory, because we've never been able to get a substantial number of Republicans to support anything close to what we are going to put on the floor of the Senate. And so I believe that this is the moment where we show to Republicans in the Senate and the House that if they support these measures that might not be supported by every single one of the Second Amendment groups out there, that they'll win votes, not lose votes. That it's a good thing to vote with 80 or 90% of your constituents, and that will allow us to build on this. What I know about every great social change movement in this country, and I think the anti-gun violence movement is in that category, point, is that they didn't get 80% of what they wanted in the first bill that passed Congress. They built on success after success. They grew their coalition over time, and that's what we're doing here, a 30-year logjam ending, not with a fig leaf, not with a box-checking exercise, but a bill that has serious changes in it that are going to save lives, that will allow us to get more success down the line.